What does your job involve on a day-to-day basis? And let's tackle the operational elements first. Who do you work with and what do you do?
I often describe my job now and my role as split into operational and strategic. So operationally, both me and the other pharmacists and pharmacy technicians and the prescription clerks, who are a massive part of what we do in primary care, we have an operational day-to-day. So we're dealing with any kind of clinical query from any of the clinicians that work in the primary care network, whether that's doctors, paramedics, physios, nurse practitioners, practice nurses. We've got all of them. We've got a very forward-thinking primary care network that employs all the Ps, as they like to call it. So pharmacists, paramedics, physios, etc. So we do all the clinical queries. There could be anything, whether it's, can I use this in pregnancy? What do I do with this person with a really poor swallow? Or look, I've got this really complicated patient. I'd just like your clinical opinion as to what would be the best choice of medicines. Then we do all the prescription query, most of the prescription queries. So if you like, the technical prescription queries about patients, because remember that we are 40,000 patients across our primary care network. And that means that we issue nearly 800,000 prescription items a year. So you can imagine that even though we've done lots of work on the prescription system, there's a lot of queries that come up. And remember that one of the ideas about pharmacists being funded by the NHS to work in primary care was to save GP time. And so undoubtedly, you do save time. But we are sensible about it, and we try to use the prescription clerks. We've empowered them, we've trained them more, and then we use the pharmacy technicians. I'm a big fan of the pyramid. If you've got sound foundations and you only have the people at the top doing the things that only they can do, then that's kind of how we do it. So prescription queries, we do lots of medicines reconciliation. So people who come out of secondary care or from outpatients back into general practice, making sure that the medicines that have changed have been updated. Myself and the pharmacy technicians provide appointments. So if you ring up and you want a duty appointment at the surgery and it's anything to do with medicines, the chances are they'll offer them to speak to myself or the pharmacy technician. And then we do a lot of what's now called structured medication review, which is, if you like, the peak of the pyramid for what I do, where I'm talking to patients about their medicines and trying to find out what's important to them and trying to optimize their medicines, essentially. And at the same time, what the practice has understood, that because of my clinical skills and background, because I worked in the diabetic clinic and such like, is that I actually do their business of their chronic disease management at the same time. So if they've got diabetes and asthma and atrial fibrillation, instead of them having to come back and seeing the asthma nurse 3 months later and then the diabetic nurse 6 months later, I can actually do it all at the same time. So I have half-an-hour appointments. So that's my face-to-face structured medication review work. And we do a lot of work for care homes as well.
Mm-hmm. And what about the strategic elements, planning future services, training, and so forth?
And my leadership stuff, if you like, is the thinking. I've always said that thinking is very underrated in the NHS, but I do a lot of it. So you have to make time to think, you have to make time to listen, you have to make time to lead. Clinical leadership requires people to think about, how do I fit in with, I talk about this influence onion, where if you're a pharmacy professional working in primary care, you've got to think about all the people that you can influence, but all the people that also influence you. And how are you going to do that? So whether that's the clinical director or the business manager or the data analyst, we don't want people doing jobs as pharmacy professionals that could be done by somebody else in the practice. So I do a lot of thinking, a lot of strategizing, working out for the PCN. Well, how are we going to deal with all these targets that we've been set by the NHS or set by the local Dorset CCG? I do my part in training. We're a training practice, so I do lots of training and mentoring. A lot of people need mentoring in relation to how they work, whether it's the new nurse prescriber, for example, or the paramedic, or a nurse assistant associate that we've got working with us. So I do a lot of that, so that I split my time into operational and strategic.
Oh gosh, I like that. The influence onion. Could you explain a bit more about the influence onion?
So there are the layers of an onion, and you're down in the bottom left-hand corner, if you like, the middle of the onion, and you've got all these other people outside you. So that's what I mean. And we now, we like to talk about pharmacy professionals, because pharmacy technicians, and I'm sure we're going to talk about these, are just as important as the clinical pharmacists. So, but it's slightly different for a pharmacy technician than it is a clinical pharmacist. And it's slightly different for if you're the primary care network senior clinical pharmacist. Your influence onion is slightly different.
You mentioned pharmacy technicians there, so let's pick that up right away. Is there a role for pharmacy technicians in primary care networks? And if so, what is it?
I'll go back to my pyramid. So you need sound foundations to do anything. And it's the same with complexity in healthcare generally, isn't it? You want the right people to do the right jobs. Now, I've worked with pharmacy technicians my entire 30 years career, and I couldn't be without them. It's a synergistic relationship, which means it's not just an additive one. You get more than the sum of the parts together. You work together to be able to provide better care. So, and one thing that's really quite important, and what primary care didn't understand with pharmacy technicians, I think, is that pharmacy technicians, in primary care, they think of technician as the technician who takes the blood, who does the ECG, okay, who does the Dopplers. Now, there's no clinical interpretation by that technician, but for pharmacy technicians, it's a clinical job. It's a clinical professional job. And therefore, it's getting the primary care to understand that they are not just technical, they are clinically able to interpret. So Darren, who's the pharmacy technician who's worked with me the longest, because I think I've already said this, I've got 40,000 patients. I've got 2.5 whole-time equivalent pharmacists, and I've got 2 whole-time equivalent pharmacy technicians. But Darren, who's worked with me the most for nearly 4 years, we've been sat next to each other, so it's been easy enough to train him up. So he's incredibly good at the technical parts of, because of the complexity and subtlety of medicines and the discharges and all the queries that come. But he's now able to, he's always been able to, but now I've been able to get the practice to understand that he can still clinically interpret things. He has a level, like we all do, he has a competence level at which it's not right for him to go beyond, but he's got skills, knowledge, and competence to do things that, I don't need to do. And general practice, I think, is really good at realizing that we don't want to get somebody to do something that can be done by somebody else. They're much better at that than in secondary care. So pharmacy technicians are absolutely paramount. And so you'll see that our balance is about half and half. So yeah, couldn't speak more highly of the need for pharmacy technicians to work in primary care.
So in fact, this is a real career opening for pharmacy technicians.
Absolutely it is, yeah. And the primary care network in which I work in were quick to understand, perhaps because I was able to sell to them, that they've been very, very supportive of understanding what pharmacy professionals, as in pharmacy technicians and pharmacists, can do for the practice and the PCN.